So I heard on the TV this week, Philip Pullman, who writes some great novels, was bemoaning the fact that imagination is being crushed in the British education system. But now I'm going to ask this last hour to call on your imaginations in quite a long way, deliberately to try and make you see how all the different areas we're going to throw at you in this next hour could relate to what you're doing in various different ways. And we're going to span the scale from really detailed knowledge about handfuls of families in Manchester to wherever you want to imagine in the cosmos. So I'm not going to take any much more time, because there's not much time to cover that, and hand over to Paul, who's been working in Manchester understanding complex families. Thank you.
Hi, everybody hear me? Yep. So I manage a primary research team within Manchester City Council. So my team's responsible for sort of planning new business solutions, new ways of working, look at the services that we offer, redesigning them, and then evaluating how they might change and what impact they have. In order to do that, lots of data challenges. We've had to get much smarter in the way that we look at information, much smarter at the way that we collect it, and much smarter about the way that we use it. So this illustration in the slide pack, the next 10-15 minutes, is just talking through what we did around trying to understand much more about families and connections between need and between sort of intervention and support that we offer to families. So just in terms of a little bit of background, you guys might be familiar, you might not. Public service reform, it's been going on for a while now within local government. It straddles lots of things. What we had before were services that did very specific things. We emptied bins, we looked after children, we provided healthcare, social care for older people. What we've had to do is start to think about how all those things interact, how all those things work together. Ill health in older people might affect children. Children's safeguarding might affect criminality, all sorts of things within there that we have to get much smarter. So we've had to move away from very siloed thinking to processes which are sort of family-focused, person-focused, place-focused at different levels. We've had to think about lots of different things, from work and skills to places to early years to health and social care. And one of the things that sits at the centre in terms of demand profile is this complex families group. So I'll talk a little bit about that. The title, iBase Journey. iBase is just a product name. It's an IBM product. It's just a database in a sense. We call it iBase because that's where we started. But basically this was about building a research database that enabled us as a city council to understand the demand of our customers and react in very different ways to that demand. It's taken us a while though. We started this back in 2010. There was a national programme called Community Budgets that was about working with communities, working in communities in a very different way. And at that point, we started to think about data and how we use data differently. In 2011, the National Troubled Families Programme came along, so people might have heard about that, they might have seen some headlines around it. It was a reaction to what were the riots back at that point. The brand was rubbish. The title was rubbish, but the concept and some of the ideas behind it were quite good and quite sound. And the biggest thing that was a driver for us was this make better use of data, identify needs earlier and respond in a more dynamic and more appropriate way. We realised in Manchester that because of the scale of our population, about 500,000 people, we couldn't do this off spreadsheets. So we had to think about new ways of collecting data and holding that data. So we did this proof of concept with iBase. We threw everything we had at it. It made a complete mess. It just created charts, tables, unstructured data that we couldn't make any sense of. But it did prove to us that actually you could put data together in one place, and if you knew the right questions to ask about that data, it would add value. So in 2013, we built our first version of a sort of operating database. It brought together various streams of information. And we started to use that then proactively in identifying families and delivering services to those families. That took us a few years to get right. We rebuilt it in 2015 because we realised that what you decide is right on day one evolves, and decisions we took then weren't fit for purpose 2 years down the line. And we rebuilt it, and now where we are is we've got a database that I'll show you in a second, which adds loads of value to what we do. It adds value to our families, it adds value to our operational workers, and it adds value to us as analysts. So in terms of iBase, I've already described it as just being a big database. What it does is it holds information about individuals, episodes, places, lots of things that are connected in all of our systems that we hold across the public service. It works in three areas. We use it predominantly for analysts to spot opportunities within the way that we deliver services, but we also use it for caseworkers to go to a single place to try and access information about individuals. And the final one is that then we can also use it within service provision and service manager level to enable them to spot opportunities to work differently with cases. The critical thing across those things is that they're all interconnected. We need good quality data as analysts, but we can't do that if we don't give something back to our frontline workers who are responsible for collecting the data and delivering the services. So there's a give and take within here. In terms of what we've built, this is our sort of simplified schema. There's a much more technical one that we shove out to people who are interested, but I don't understand. Within here, we've got 6 buckets of data that we collect around families. The first bucket being health. We don't get information from the NHS. Patient data we can't access, but what we can access is information that our social workers have collected as part of their assessment. So where they have used standardised tools around drug, alcohol and mental health, we can access that information and share that with other operational services within the team. We get information from schools about all pupils, so we know about all children who live in our city and the schools that they attend and the types of things that happen at those schools. We get information from Greater Manchester Police around offending behaviour, so anybody who has a proven offence, we can collect that information and pull that information into the model. We've got a proxy in there for finance. Finance is sort of trying to look for poverty and debt-related issues. Within there, what we've got is council tax arrears, so anybody who crosses a certain threshold in terms of arrears comes into the system, and we've got free school meals. We've then got a bucket of indicators around work and skills, and this is predominantly about unemployment and benefit claimants, so ESA claimants, JSA claimants, universal credit, etc. And then we've got child safeguarding, because this was born out of the Troubled Families programme. This was predominantly about safeguarding children and understanding their needs. All of those things already existed, but we built a system that connected people at the centre around that. So each one of those records relates to an individual person and has a series of episodes. Previously, they were all in separate systems, in separate services that didn't connect in any way. So we built the system to connect it to people. We need to do some fuzzy matching and other things along the pipelines to make sure that Paul Holme in one database is the same Paul Holme in another database, but we've worked through the model around that. The benefit, though, that we get from iBase and from the database that we've set up is that although those records relate to people, most of those records have an address associated with them or multiple addresses. So Paul Holme, as a person, sits at the centre. I might have records that pull through in terms of my health, my offending, my working skills, benefit claimants. That comes through. I might be known to 14 different addresses in those systems. This now enables me or somebody to see that there are different addresses that I'm associated with at different points in time. Once we know that there are addresses that we're associated with, we can then start to pull through additional information about addresses. So we've got people-based data at the bottom, we've got address-based data over on the left-hand side. We can start pulling through information about rents, landlords, sort of characteristics of the areas, police call-out type information, where do the police turn up to on a regular basis. And then finally, our systems aren't great at families or networks, and I think it came up in a couple of the presentations earlier. How do you connect people together? How do you understand the connected impact that people have on each other, whether they be families, peers, or other networks? And again, the database enables us to do that. In terms of some of the outputs then that we get from that, in terms of building this database, and as I say, it was a long journey to build it, so we've invested quite a lot of time and effort. But where we are now, we can do sort of dynamic dashboarding like this, that talks about lots of individual issues and lots of characteristics on the overall system. So within here, we've got the chart, the bar chart on this side. 72% of the families who were in the Trouble Families programme at the time had regular police call-outs to their home address. 67% of them had domestic violence issues within those properties. We could do all this using spreadsheets because this is very siloed. This is still just saying 72% of police call-outs, 67% are domestic abuse, but it's speeded up the process. So this bit's become more efficient, but it isn't necessarily new insight for us. But bringing the data together, we can start to then do more complex analysis across the systems and across the profile of needs within families. So within this example, lots of numbers. This is cross-tabulating all of the variables that we collect within the system. But in terms of the example, the one that's just pulling through, and apologies, you probably can't read the numbers, what this is saying is that 61% of the families in the database had a mental health concern that was flagged within the family. That could be perceived as an NHS problem. These families need additional investment in the NHS to deal with a mental health problem. As we start to look across, we then see that 45%, nearly half of those families who are identified with mental health are also known to the police for antisocial behaviour, and nearly 3/4 of them are known to the City Council for child safeguarding issues. So quite quickly, in a way that we couldn't look before, we can now start to say, actually, this is a cross-service, cross-department, cross-organisation set of issues that we need to work with jointly. We can map all this. I think someone said earlier, we all need to put a map in our slides. So this is my map. The interesting thing that we started to find when we overlaid place-based things was that in a city like Manchester, in a growth perspective, we always view transiency as a good thing. Young, dynamic workforce, graduating, accessing jobs, moving around, being very vibrant and very dynamic. When you couple this with the characteristics of demand and troubled families, as the programme was, you start to see that transiency becomes a huge risk factor. If you aren't connected to a community, you've got massive more risk around your situation than in those places where community exists. What we then moved on to is that once we started to understand this insight, we got an immediate request from our services to say, well, actually, you analysts sat in a room doing all of these pretty things, understanding what the service needs to look like. Our workforce needs to see this information. Our workforce needs to be able to use that on a day-to-day basis. So we started to adapt the system to be able to deliver that. It doesn't replace any of the things that frontline workers do. They still do case conferencing, phone calls, reviews, assessments, but what it does is target the way that they go about those. And I've got a couple of quick illustrations around that. The first one, and this is what sort of iBase produces for us in terms of sort of the visual that comes out of the database. We've got two families in this diagram. Family A on this side, they've got complex characteristics. They've got members of the family that are unemployed, that are involved in criminality. They've got child safeguarding. They've got a whole range of issues. They're not being supported currently by the system. They've got universal support, but not a coordinated approach. Family B have got equally complex issues on the other side of the chart, but they've got a whole family worker, so they're in the programme. They're getting a package of support. What we didn't know before is that little lozenge in the centre is that these two families are connected in a really strange extended family way. They are step cousins in the model. It's very strange. But actually we started to talk to the caseworkers and they said, well, actually the investment in family B is being underwritten and broken down by the effects of family A, who we're doing no work with, so we could coordinate our approach and do things very differently within there. This example then is more sort of the key worker sort of case allocation approach. What we've got here are 14 young boys who are all involved in low-level criminality within a particular area. Current situation is there are 14 youths supported by 14 separate workers, 14 separate organisations, all treated in 14 separate ways. Rightly, because we're protecting and safeguarding those 14 children as individuals. When you start to look at the data, though, and look at the connections, you see that they're all connected, and we start to see they're all attending one of two schools. They're all most of the criminality radiates out of two individuals within the network. and they all live in one place. So radically, we could think about redesigning our services to say, rather than having 14 social workers doing 14 separate things with children, we could coordinate that far better and work much more as a collective and work very differently. So the final slide sort of from me, because I'm conscious of time, is that where we started with the first slide, public service reform has put us in a position where we've got to do far greater integration of services than we've ever done before. And the integration of services is going to underpin the reform project and the programme of work that we do. If our data, our analytics, our approaches don't follow suit, then actually we fail before we start, and that's why we've tried to invest in something like iBase. And I'll leave it there.
Thank you very much, Paul.